Hi, welcome back to the Beauty Authority. I'm Tatiana Bido, Director of Aesthetic Content. Today, we're talking about breast revision surgery, one of the fastest growing areas in aesthetics. And I'm joined by Dr. Michael Stein, a plastic surgeon known for his work in breast surgery and complex revisions. Hi, Dr. Stein. How are you?
I'm great. Thanks so much for having me.
Thank you for coming and speaking with us at New Beauty. You've built a practice focused on breast surgery and revision. What are you seeing the most right now in your patients coming in to have a secondary, third, or fourth revision surgery?
I think the most important concept to articulate is that breast surgery is not one size fits all. And when it's treated like that, there's a tendency for more breast revisions. And so I deal with breast revisions, all shapes or forms, and patients come from all over for me to fix anatomical problems from previous surgeries. And, I've seen it all. Basically, mostly we see patients that have implants that are too big for their frame or specific anatomical abnormalities that haven't been addressed during their first surgery.
One thing I think I see a lot of too is just people's lifestyles changing as they get older. And what they liked in their 20s or early 30s may not fit for them later on in life. Is that a reason, a popular reason that you see people coming in for a revision?
I think trends are dangerous in general in plastic surgery, but specifically in breast surgery. And what we see is when breast surgery is treated like a one size fits all, you see people following Instagram trends. So, there might be a trend for taking out your implants and getting an on bloc capsulectomy. And you'll have literally thousands of patients seeking surgeons who perform this operations, some of them that don't need that surgery.
Yeah.
Something it might be trending that implants placed above the muscle is more in vogue. And so you'll have patients thinking that's the only way to do it. And they'll present to surgeons that only do this operation, when in fact, many patients are better served with implants under the muscle. So, for example, if I have a very tall 6'2" model who's very skinny and flat chested with not a lot of breast tissue, she's better served with more tissue shielding that implant to make it look more natural. So placing it under the muscle is actually better. So, these trends are a little bit dangerous, and people follow what they're seeing, celebrities or influencers posting, but really you need to respect the anatomy. And respecting the anatomy means every patient's anatomical presentation is different. And even within the same patient, each breast might act completely differently. One side might have stretchier skin than the other side. One side might have more breast tissue, or the pocket might be tighter. So, you have to get it right the first time. And respecting the anatomy prevents the need for revision years later.
And how often is it that someone's coming in and they just don't like the way that their breasts look after an initial surgery?
It's I'm biased because I'm a breast revision specialist and I see patients from all over with these problems, and they present with a variety of different problems. But in general, it's not too difficult to get a beautiful result for the first 6 months. But the successful breast surgery is a surgery where your result persists for years and years, and so things shift over time if you don't respect the anatomy. So, I'll give you one example. The rib cage is like a platform, and if you put an implant on the rib cage, it's not just slipping in an implant and you think it's going to stay, right? Sometimes the rib cage is a little slanted in women, or one side is straight and one side is slanted more, or both sides are slanted. So you have to respect that anatomy. And when dissecting your pocket, really pay attention to that, because for the first 6 months, everything's going to look great, but gradually over time, gravity will win and forces will be pushing that implant in certain places. So, implant malposition is the most common thing I see. And most times it's because they have anatomical abnormalities, whether it's their breast tissue or their rib cage, that's, over time forcing the implants in a different direction.
What about, because right now we're seeing so many people's bodies changing rapidly with GLP-1 weight loss. Are you seeing people come in who maybe would have been fine before, but because of this, rapid weight loss, it's triggered a need for a revision?
GLP-1s just, generally have increased volume for all plastic surgeons.
Yeah.
Skin more stretchy, things are moving. Patients who had implants before and now have lost their weight fairly precipitously. The skin envelope stretch and the implants can move more. So I'm definitely seeing a lot of patients on GLP-1 drugs that need breast revision. But for the most part, what I see inside is that there are anatomical issues that weren't addressed during their primary surgery. It's not really the GLP-1 drug's fault. It's, not addressing those anatomical issues during their first surgery.
And speaking of anatomical issues, I spoke to you recently about Jennifer Fessler from the Real Housewives of New Jersey, her revision surgery, and you introduced a phrase to me called bottoming out.
Mhm.
What is that? And what did you do to help address that issue that she was having?
So I see many patients like Jen, and they come to me having 4 or 5 operations in the past and saying, I've never been happy. Can you fix my problem? And bottoming out just means that the footprint of the breast has changed over time. Whether you have implants or your native breast tissue, it's stretched. And so the distance from your nipple to your fold increases because everything kind of droops down. So if
Mhm.
an implant is placed, for example, and it's too big and heavy, it'll stretch out that skin and the implant will move and bottom out. And
Mm.
sometimes during on bloc capsulectomy surgery, the inframammary fold or the fold will be violated. And even if you don't have an implant, your breast tissue will shift down over time because there's no, end stop between the breast and the tummy.
Can you describe what unblock capsulation surgery is and why it's so specific when someone's having an explant surgery or a replacement?
So on bloc capsulectomy is actually a cancer term, and it really describes surgically removing the implant with all of the scar tissue around it in one time on block, one piece. And some patients need it, and many patients don't. And sometimes when you're removing all that scar tissue, you inadvertently you remove some of the supportive tissue of the breast, so the breast borders. And so a lot of patients come to me, they had their on block capsulectomy years prior, they want their implants back in now. You can't just slip in an implant and hope for the best. You have to reconstruct all the breast borders. So you mentioned Jen. Jen came to me, she had her implants removed with all the scar tissue. She had bottoming out, and I had to recreate the breast fold, the lateral breast border, and the cleavage because she didn't have it anymore from the previous surgeries.
And for Jen, you also included an internal bra,
Yeah.
right? So can you explain, because we say internal bra here at New Beauty a lot, and I know what it means, but can you explain to our listeners and our viewers what that is?
Yeah. So if you're putting in an implant, or even if you're getting a breast lift, there's the weight of either the implant or the breast tissue that's exerting a force on your skin. And initially, you might have a beautiful breast shape, but over time, the skin can stretch and things can move south. That's, the inherently what bottoming out means.
Yeah.
An internal bra is basically a scaffold of suture material. It's absorbable. It's replaced by scar tissue over time, and it's like a hammock that provides support to the lower pole of the breast, supporting that implant or your breast tissue. And in patients with bottoming out, they've lost their inherent anatomy. They have no support, so a lot of them get that hammock of scaffold during their surgery.
It's so fascinating, right? All of the tools that we have now that can help with breast revision surgery. What about if you've had a lift and then now you've lost weight, right? So you don't have an implant, but let's say you've lost, 30, 40 pounds. What is a good fix for that? Do you need to have a revision breast lift?
I mean, every patient's different, but I see a ton of patients who had breast lift surgery in the past, even, a year out from breast lift surgery, and things have shifted. And so it really comes down to what I was saying before. I'm respecting the anatomy. With-
Yes.
There are patients that you can make them look amazing on the operating room table, and then over time they will stretch, right? And breast surgeons who do a lot of this will feel their skin and know that it's stretchy skin and things are going to stretch over time. So they actually will over tighten the tissues in anticipation for a certain degree of stretch over time. And these are, challenging cases dealing with patients because you're actually giving them a result for the first 6 months that doesn't look as good, but over time stretches to the perfect amount and then looks good for many, many years. And so there's a lot of hand holding at the beginning, where you basically tell them, trust me, it's going to change. It
Yeah.
looks a little bit funny for the first couple months, but you're going to have a beautiful result for a long, long time because of this. And if I had made that patient perfect on the table, and I just let things stretch on their own, things would change over time for the worse. So breast revision and primary breast surgery is really, kind of going where the puck is going, not where it is. You need to
Yeah.
like, anticipate what's going to happen to that breast over time.
I like when you say respecting the anatomy. And then can you explain what that really means? What are you looking at in terms of like balance and harmony when you say respecting the anatomy?
Yeah. You know, breast surgery has really been oversimplified on social media. And a lot of patients treat it as, making a pocket and slipping in an implant or just lifting the breast. And it's very simple. It's like, a one and done. But everyone's anatomy is completely unique. And like I was saying before, within each patient, sometimes each breast acts completely different. Like one breast might be much stretchier than the other one. So you're doing different surgeries on everyone and doing sometimes different surgery on the same person between each breast. So respecting the anatomy really is first looking at the rib cage and the platform of where the breasts sit and looking for any anatomical variations that you have to address. And if there's asymmetries, you're doing different procedures on both sides. You're feeling the tissues on both sides and seeing, oh, the left side, it's much more droopy and stretchy. This is going to change over time. I'm going to over tighten this side versus the other side. You're basically doing these fine tuning changes in your technique based on the anatomy. And sometimes it means there's a settling period. So if
Mm,
you do different surgeries on both sides, initially a patient might, wake up from surgery and one breast is over tightened compared to the other one. And they're like, oh, they're a little off. And that is what you did on purpose because that one side's going to stretch over time. So I keep reiterating to patients that a successful surgery is a successful like 1, 2, 3 years old and on,
yeah.
not the first 6 months.
So they're like our breasts are like our eyebrows. They're not identical.
There's nothing's perfect, nothing's symmetrical in life. That's just
Yeah.
how things are. But respecting anatomy means understanding what's different and the moves you're going to make them as symmetric as possible in the long run.
Beautiful. And for someone who is considering a first time surgery, what are some tips that you have that can help avoid a revision in the future?
You need to do your research. You need to understand your own body and your own anatomy. And you need to find a surgeon that does this a lot and understands your specific anatomy and is going to respect that anatomy so you have a long standing result. A lot of patients unfortunately pick their surgeons on Instagram nowadays and follow trends. And I have to reiterate this again, trends are dangerous. Every patient is unique and you have to have a toolbox to be able to do everything and do what's right for that patient's anatomy.
And this is might seem like a silly question, but should you always go back to your original surgeon when you realize either you don't like your results or you want to change something, or should you find another surgeon for your revision?
I think communication with your original surgeon is key, but ultimately, if there's a problem that you don't think that could be addressed with that surgeon, you find someone that specializes in breast revision surgery. But you should see a variety of surgeons. You should do your research, see what different people say. I've had patients that have come to me and they had surgery 3, 6 months prior from another surgeon and they want me to revise it. And I say, I won't because it's going to take time for things to settle. And you need to speak both to your original surgeon and me and come to an understanding of what's wrong at a year and see if it can be fixed. But, it's important to speak to your original surgeon,
Yeah.
but you need to get a breast revision specialist who understands the anatomy if you want that longstanding result.
And then lastly, if someone is unhappy with their breasts and they're considering a revision, what's your best advice?
If you're You need to first understand, I encourage everyone to take pictures. Their surgeon should take pictures and they should take pictures at before surgery, right after surgery, and literally, weekly and monthly thereafter, because you want to see how the breast changed over time and understand what happened to the breasts. And then seek a breast revision specialist who does this all the time and say, look, here are the pictures. Here's the information of what I got done, and here's what changed over time. And with that information, the breast revision specialist can be like, okay, it's the tissue that needs to be tightened, or it's the fold that became laxed and was violated and you had bottoming out. There are patterns we see, and we see kind of the same patterns all the time. So yeah, you got to bring that information to your new surgeon.
Amazing. Well, thank you so much, Dr. Stein. You're a wealth of information and you do amazing work. So I'm super grateful that you were able to come and share your insights with New Beauty.
Thanks so much for having me, Tatiana.
Thank you so much.